instead of hearing from me, I'd like to introduce you to the head of our health panel, Dr. Michael Dimayuga.
Hi there. So many people ask this question whenever I do these presentations, and it's interesting because I've now come to the realization that everyone starts out a skeptic, and that's good. Approach this program with a healthy dose of skepticism. However, having said that, we have now helped and coached so many people to success that I can tell you, listen, start out the skeptic all you want. I know you're going to have success. And we're going to tell you and share with you why you're going to have this success. But it's so interesting because I hear this all the time. And, you know, folks initially say, well, how do I know that this will work for me? Or how do I know that you know what you're talking about?
Well, it's funny you should say that, okay? What are some of your credentials coming in to MyGreat28, and how would these factor into what you're doing?
In a former life, before I decided that I wanted to be a doctor, I was in fact an athlete. And the only reason I bring that up is because as athletes, we were constantly training and not just trying to keep our weight down, but build up muscle. So that aspect I have kept with me all my life. In my life as a doctor, however, I started out like every doctor. I did my internship and my residency training, but I did my program at a Yale-affiliated facility, and at the end of my training, I was nominated to become chief resident, which means I was now part of the teaching staff. I was also simultaneously in charge of the medical intensive care unit, and the one thing that that whole experience taught me was it is attention to small details that clearly makes a big difference, especially in critical situations. And if nothing else, that lesson applied to this program is what has allowed me to help and coach people to such success. Attention to small details. I will go over things that you might think I'm a little bit obsessive about the details, but guess what? It is attention to those small details that allows me to help folks get the results that they want. I was also blessed at the same time that I was doing my program, my training program, that I was awarded a faculty position at Yale University School of Medicine. I was a clinical instructor in the Department of Medicine at Yale during the same time that I was chief resident at my facility. So yes, I'm a doctor. Yes, I've had a little bit extra training. Yes, I've been an athlete, and like everything else, it's something that comes together. But like so many other good stories, I have a personal angle to the whole thing. I had suffered a few sports injuries, and you know, you get to a certain age and you don't bounce back quite as rapidly as before. And despite being an ex-athlete and a physician, everything that I knew to do to help me lose weight would not work. And then I saw this program, and yes, I was a skeptic at the beginning, but I said, you know what? Everything that I know to do is not working. Let me give this a shot. And so I did, and so the next thing I know, I've lost 15 pounds, and guess what? It's a good program. It works, and I can make it work even better by applying the medical knowledge that I have.
So now we know, because what I was going to ask you, I mean, your credentials are beyond measure, but so now we're getting to the root of the issue, because this is what I wanted to know. What drove you to look at this type of program, and why did you see that this could benefit so many people?
Well, I'm a primary care physician, I'm an internist, and where I live and work in Central Florida, a lot of the health problems that I deal with on a daily basis are ultimately obesity related. And you know, if you look at the broad span of time over the last 30, 40, 50 years, the obesity rates in this country and now all across the globe are skyrocketing. And if we don't control the magnitude of the problem, it will in fact overwhelm us. We need effective solutions. And yes, I was part of the problem initially, because when my patients would ask, what can we do? I would say, well, you know, try this diet, that diet, or this, that, and the other thing. So I was telling my patients that they needed to lose weight, but I wasn't really giving them good information as to what would help them lose the weight. And then, like I said before, I had a sports injury that led me to a 15-pound weight loss, and nothing that I did worked. And then I found the system, and literally within about 2 weeks, my wife had to tell me, you need to slow down this weight loss because you're going to disappear. Now, I know that a 15-pound weight gain does not sound like a lot, but for somebody who'd never had a weight problem, all of a sudden I was waking up with reflux. And I knew as a doctor that would lead to cancer of the esophagus. I also have diabetes on both sides of the family, and that 15-pound weight loss was like throwing the doors wide open. And I did not want that. So when I saw this program, since everything else that I had been doing did not work, I said, you know what, let me give it a try, and it certainly worked.
Well, at 15 pounds, it's funny. For someone like me that needed to lose a lot more than that, 15 pounds doesn't sound like much. But when you get rid of 15 pounds, that is a tremendous amount of mass. And I think it's incredible that you needed to lose that and that you did, and that, oh my goodness, you understand why someone like me was just so elated with what this program does. Okay. So as a physician making recommendations to your patients or to your clients, what were some of the criteria that you needed to see to move forward with MyGreat28?
Very, very good question. And of course the answer is multifaceted. First of all, I needed a system. I needed a system because it needs to cover a whole host of different variations. As a physician, I very much know that there is no such thing as one size fits all. So I needed something that could be applied either in its entirety or different components. Secondly, of course, I needed to know that the science was good. I mean, doctors are, if nothing else, science geeks. You know, we stay up all night reading research papers and we think that's, ooh, a page turner. Third, there had to be a well-designed clinical trial. More importantly, the results had to be impressive and statistically significant so that it would bring the system into focus, because it's one thing to have something that looks good on paper. We see that all the time in the field of medicine, but it must translate into real quantifiable results. And then when we get to these impressive clinical results, which is the fourth point, I can get my patients to achieve similar results, but I have to use large doses of multiple drugs. And of course, they all have side effects and costs associated with it. With this system, I can get as good results as I would with prescription drug therapy without the cost of the prescription drugs or the cost of the doctor visit or the risk of side effects or drug interactions or the cost of monitoring the drug side effects. So when I looked at all of these things and put them together, I said, you know what? I can achieve more good for my patient with virtually no risk to their health. And as a physician, I said, it's a no-brainer. Now, this system was so important for me because when I talk to people now about weight gain and obesity, they're always asking, well, what about this and what about that and what brings this on and what brings that on? So I had to have a system that met all the prior criteria I talked about. And then we had to have something that would optimize the foundation of all health, which is nutrition. As a primary care physician, I'm an internist. I know that if my patient is in a good place, nutritionally speaking, I can do a lot of good things. If, however, they're nutritionally unbalanced, it's an uphill struggle if I get any traction at all. So the first thing we do is we optimize the foundation with the highest quality science-driven supplements. We then empower the individual with the homeopathic component, help them recover from the addiction that is at the root of so much of this problem. Additionally, the program, and this is where I love the program because it ties into my passion to teach and educate. The program educates the client on the key points of the system and keeps them engaged in the entire process to make sure that they have success.
Well, that is fascinating to me because that was what I was going to ask. Why this system? And you absolutely just covered that because there's just a maze out there of do this, take this, try this. I tried them all, and nothing got to the root of the issue. You have no idea how enlightening what you just said was for me. Now, let's talk about the other part. In our daily life, how do we weave this into a crazy life? Kids, spouses, working, eating on the go. How would you talk about that with regards to MyGreat28?
Well, as part of the educational process, and this is the part that most people start pulling back from, and this happened this afternoon as I was guiding a client through this portion of the program. We have to teach folks how to read and make sense of nutritional labels because this is stuff that we're going to be buying and consuming and eating every single day. And we have to be able to make sense of what is really in the products that we're buying rather than what the marketing tells us or leads us to believe is in the product. We need to be able to sort all of that stuff out. Also, we need to be able to sort out through the fast food maze because and inevitably the question comes up, well, what if I have to eat fast food? Is there something? Are there choices that are available to me? And I always tell folks, yes, there are. And that is part of the educational process because there's so much information out there today. And the one thing that a doctor truly brings to the plate when it comes to sorting out all this information, medical information, nutritional information, exercise physiology, we bring perspective. Somebody might be dealing with this issue for the first time in their whole life. The physician, on the other hand, may be dealing with it for the 10,000th time. We know all the different components already. There's very few things out there that surprise us, which is a good thing because we can then share that with folks. You might have a hiccup in the program and it's the first time you've had the hiccup. I might have coached 500 other folks through that hiccup. You might panic when you hit the hiccup. I just smile and tell you what you need to know in order to get past it. So that's so important.
Well, wonderful. That's great because with you walking us through all of this, I just wanted to ensure to everyone that if they ever do feel like, oh my goodness, can I squeeze this in? Yes, it's part of my life now, our daily routine, and it was because of your coaching that helped us do that so that so that we didn't look like this. And
oh, yeah.
So I love that picture. So is there a specific product that created the paradigm shift in your thinking? Really something specific that set this apart? And then we'll wrap up this conversation. And thanks so much for taking the time with us tonight.
Absolutely. And you know, Woodson, that there was one product that made me sit back and think to myself, okay, this product uses the same exact science I already know. So when I started looking at the whole issue of weight gain and the difficulty people had losing weight, I came to realize that just about every program talks about exercising, dieting, and improving food choices. And every program out there emphasizes these three things, and every program out there has limited success, and every program out there has rebound weight gain. Our program does not have limited success. It's actually, I've come to the conclusion that there is no upper limit to the amount of weight somebody can lose on our program if they truly wanted to push it. But the surprising thing was the absence of rebound weight gain. And once I had the chance to sit down, think through the whole thing, that's when I realized it is the toxins that we encounter on a daily basis that was driving the whole equation. And our system has a specific product designed for removing toxins. It is the Restorix. And when I talk to folks in the medical field, nurses, other doctors, I can actually tell them that this product behaves almost like dialysis. We can pull substances out of the body tissues as well as the blood. And once I found that we could effectively, very effectively remove toxins, all of the rest of the system fell into place. Lack of rebound weight gain, the speed at which the weight comes off, all of it fit together, and I said, okay, this is science-based. It's the same science I know, and I love it. So much so, I have absolutely no reservations now. When I talk about this program, I do it in the form of a wellness and weight management seminar. I talk about my background as a doctor, the problems that lead to weight gain, how difficult it is to get rid of, and then why our program is so different. And it hinges around that product, the Restorix, the detox product.
Well, this is amazing. This is wonderful. And the coaching that is provided for everyone, no matter where that they are, is just something that I want to thank you for all your time and your research and everything else that you have done to provide for us. And then the last thing that you really helped me with is that you said we were going to be successful. And I needed to hear that. And then you told me the definition of success, the achievement of something desired. So do you have any last words or thoughts for measuring everyone's success out there that's having fun with us and all of the people that are getting ready to join us?
Absolutely. And, you know, your reason for starting the program may be that you wanted to see the number on the scale go down. And that's good, and that's a worthy goal. But maybe you wanted to be able to play with your kids or your grandkids, and you could not because of excess weight. Well, if we get you to that point, that's success. Maybe you wanted to fit into a particular clothing size, or there was a reunion coming up and you wanted to make, you know, your ex from high school regret his decision. Whatever the case may be, it could also be medical. You did not want to go on statin drug therapy for cholesterol problems, and we help you achieve that. There are many different ways to measure success. It should not only be about the number on the scale. That might be a good starting point. But success comes in many different versions, and however you define success, if you let us help you, we will get you there. I know the program works because I have seen and coached so many people through this, so we know it works.
Well, I cannot thank you enough for your time, Dr. Dimayuga, and to everyone, we can't wait to help you with your MyGreat28 transformation. We want to hear from you. Join for free. Register on the website. Look at the before and after gallery. Read the stories, and we can't wait to share your success with the world. Thanks so much. Thank you, Dr. Michael Dimayuga, and thank all of you for joining us. Bye.